Hey everyone, I'm Dr. Dawn Costantino and I am your prenatal chiropractor here at Performance Place Sports Care. Today's episode is all about the real aches and pains that you feel during pregnancy, ones you might even be experiencing right now. If you're pregnant and you're wondering, is this normal? Why does everything hurt? Then you are in the right place. The most common types of pregnancy pain are round ligament pain, pubic symphysis dysfunction, SI joint discomfort, and sciatica. We're gonna walk through what each of these feels like, why it happens, and what you can do about it. As I mentioned before, I'm a licensed chiropractor at Performance Place, and I work with pregnant and postpartum moms looking to manage discomfort during pregnancy and recover properly postpartum. But remember that I'm not your chiropractor, and this is not medical advice. Round ligament pain is one of the most common dysfunctions in pregnancy, and it can really catch you off guard. The round ligaments are like stretchy cords that support your growing uterus. As your belly expands, these ligaments get pulled tighter. Women often describe it as a sudden lightning bolt or a zinger, pain that shoots from the lower abdomen into the groin, down into the labia, or even into the inner thigh. I remember one soon-to-be mom said it felt like somebody jabbed her with a knife when she was rolling over in bed. I know for me, a lot of times it feels more like an intense pulling sensation in the lower abdomen, especially when I get up from the couch from sitting for too long. This pain usually only lasts for a few seconds, but it's intense enough to really slow you in your tracks and stop you from doing what you're doing. It's usually triggered by quick movements like sneezing, getting out of the car, turning over in bed. While there's not much to prevent it completely, gentle hip mobility work, belly support bands, and controlled movement can help reduce some of this strain. Here's the treatment that I have found helps with many of my clients and even is helping me during my pregnancy. So whatever side is bothering you is the side that's going to be up away from the floor. For me, it's my right side today. So what I'm gonna do is grab a nice thick pillow that feels good for us to lay on. I'm gonna put it right up against my hip here, okay? Depending on the pillow that you're using, you don't want it to stretch long ways here. You wanna be able to wedge it into the side of your obliques here, okay? So I'm gonna pull that towards my hip. I'm gonna lay down over it here, all right? And then I'm gonna let my knees come close to my chest and then just support myself in this position, okay? What you don't wanna do is allow yourself to twist. Find a nice neutral spine, okay? Find a nice fetal position, feeling like what your baby feels like inside of you, and letting your hip drop open on the other side of the pillow here. If this feels okay for you, you can progress by dropping this knee backwards, maybe even reaching overhead a little bit here. And all we're doing is breathing for 1 to 2 minutes into the pillow. If that downward hip is bothering you, especially where it's touching the floor, just add a little rolled up towel underneath there just to give you some extra cushion. This here has always been my go-to for round ligament discomfort on one side. About a minute or two of breathing usually reduces it pretty significantly. Right after this, I will follow it up with getting some stretching through that side of the hip that's bothering you. So what I'm gonna do is come into a lunge position, all right? Problem hip is down. I don't want extreme stretching of the hip flexor here, okay? That's gonna pull and tug like crazy even more on that side. What I have found has worked for me and my clients is actually taking this front foot here, okay, and opening up space for the pelvis a bit. Okay, we're gonna reach for the floor and then we're gonna slide that knee backwards or pull the pelvis forward to get a nice easy stretch just in the front of the hip crease there. You shouldn't feel a whole lot of it all the way up into your abdomen or your uterus. If you do, you're probably going too far. Just slowly rock in and out of the range of motion that feels like it's just giving you a nice light tug in the front of the groin there. So let me just show you from a side view here. Okay, opening up that front foot to allow for you to reach for the floor, all right? Slowly rock the pelvis forward in and out of the range of motion that feels good for you. Can even hang out, maybe rock back and forth here a little bit, just to get a little extra mobility into that hip. Lastly, I like to add in also too what we call a door jamb squat. So being inside of a door jamb that you can hold on to something in front of you, or maybe even a pole, your partner, something that allows you to have some counterbalance into a deep squat can be helpful for this one. But as you may notice, your pelvis starts to really open up through pregnancy, and so you might even be able to just get into this squat on your own. So I'm just gonna open up really wide for myself here, okay? Take my elbows in between my knees and drop my butt to the floor here. And just allowing myself to really breathe deep into the pelvis, feeling like you're breathing down into the floor. Giving a little bit of pressure outward with your legs here can help keep your balance, okay? And then letting yourself just really sink into this, okay? Again, what that looks like from the side here is opening up as wide as what's comfortable for you, okay? Elbows between the knees, give a little outward pressure, dropping the butt, and letting yourself sink into this here. Breathing deep into that position and holding for as long as you comfortably can. Pubic symphysis dysfunction happens to the joint in the very front of your pelvis, called the pubic symphysis, that typically loosens up or becomes unstable due to hormonal changes during your pregnancy. It feels like deep pain in the front of the pelvis. Some call it something that feels like lightning crotch, or like my bones are grinding together there. Some say it feels like somebody kicked me between my legs. Others say I can't walk without waddling because it feels like I'm maybe splitting in half there. Pubic symphysis dysfunction pain is worse with things like walking, climbing, or lifting one leg at a time, like when putting on pants. You might even hear popping or clicking in the front of the pelvis. What helps? A pelvic support belt, modified movement patterns, or seeing a prenatal chiropractor or a pelvic floor therapist. The goal is to stabilize the joint and strengthen the muscles that help support that joint, especially things like your glutes, your adductors, and your deep, deep core. I may put a list of my favorite exercises for this in the link in the description. SI joint pain is felt near the back of the pelvis where the sacrum meets the iliac bones. During pregnancy, your hormones soften the ligaments around that joint, which can cause some excessive movement in these areas. It feels like a dull, achy, sometimes sharp, right around the back area here of your pelvis, typically where you can feel those little dimples in your low back. Some describe it like they feel like their butt cheeks are on fire. Others say it feels like their hip is jammed every time they take a step. For me, it feels like some intense aching, sometimes upper glute cramping, and just feeling like I need to kind of stretch it to ease some tension. It can be one-sided, but I myself have felt it bilaterally most of the time. You'll usually feel it with walking, standing, rolling over in bed, especially if you've laid on your back for a period of time. So what helps? Manual therapy, adjustments, and a little bit of rounding of your spine. I'll show you what I've liked to do. Typically, I feel it when I'm in standing positions, maybe leaning on one leg more than the other. And so when I'm in the kitchen and I feel this, is I will slide my hands down to my knees here and allow my butt to get really heavy. Notice that my low back starts to round a little bit here. I try to keep that and drop the butt into a bit of a squat and then come back up and find a hamstring stretch. Stop, drop, and then find a hamstring stretch. This here, after just a few, I notice all that tension kind of on the backside here, maybe even that cramping starts to ease a bit. You're really just offloading any of that compression from those joints there. It doesn't take very long for it to feel like it's getting some improvement. Another thing that you can do even before that comes on are things like child's pose and deep breathing. So I usually multiple times throughout the day will find this position just to get ahead of any feelings of like compression or cramping in that area. So to start off, okay, depending on what's comfortable for you, your hips, your knees, your belly, we want to open up and again, finding the width that feels right for you. Reaching forward here. Okay, dropping your elbows down, you can stack your fists and drop your forehead to your fists here. Okay, showing you from the side, opening up the knees, reaching forward, okay, onto the elbows, onto the fists, and just breathing here. You'll feel a light, gentle stretch in the low back and upper glutes. You'll feel that tension start to ease. Breathing deep into your thighs, not with your chest, but like breathing into your butt here and feeling that tension ease. If you can't do this position, give me a ring. My contact is below and I do telehealth. I'd love to help you find what position is maybe more comfortable for you and helps ease some of these pains that we're talking about. Sciatica happens when the nerve that runs from your low back down the glute and into the hamstring gets irritated or compressed. What does it feel like? It feels like burning, sharp shooting electrical sensation from your low back into your glute, down the back of your leg, sometimes might even reach your foot. Someone once told me it feels like their leg is on fire. Others say that they can't even stand up without feeling like a stabbing pain in their butt. For me, it typically feels like a tight hamstring, fatigue on the back of the leg, and sometimes my big toe going numb when in certain positions for too long. Sciatica in pregnancy is typically due to the postural changes, the pelvic tilt, and the muscular imbalances that come with it. This especially happens when you favor one side more than the other, like carrying a child on one hip or sitting and leaning into one side when you're sitting down throughout the day. What helps? Gentle sciatic nerve glides, hip and core activation drills, and some soft tissue work on the piriformis and the glute muscles. Prenatal chiropractic or physical therapy can help offload that irritated nerve and restore movement. So why does all of this happen? Pregnancy just shifts your center of gravity as your belly grows, changes the position of your core muscles, and increases ligament laxity around the pelvis. Remember, these are all things that are actually necessary to grow and birth your baby. They're not problems, they're just things that you need to be educated on and need to be managed. I personally have experienced all of these aches and pains throughout my pregnancy, and remember, not all of them have lasted for very long. Some of them only a few seconds to a few minutes, some of them to a few days, just depending on the phase that you're in your pregnancy. They have all been managed really well through specific movements, targeted exercises, and seeing somebody for treatment throughout it. All of this can feel really difficult on your own if you're just unfamiliar with some of these sensations and don't know what to do about it. I promise you, you can stay active and feel fairly comfortable throughout your pregnancy. If you found this to be helpful, please subscribe and leave a comment below telling me what kind of aches and pains that you've been dealing with your pregnancy. We'd love to hear about your experience, and I will see you guys in the next video.